Hi, everybody.
Hello.
We
We
are
are
the
the
Stethoscope
Stethoscope
Diaries.
Diaries. I'm Dr. Tanya Franklin.
And I am Dr. Tawana Coates.
We are going to be talking about a pretty important topic today.
I'm excited about this topic. We're talking about pelvic exams. I think it's an important one because our patients get a lot of anxiety about pelvic exams when they come and see us.
They sure do. They have trauma. They've heard about people's experiences. They watch videos online. It
Yes.
makes them even more intimidated.
Yes.
So the goal is to try to educate you so that you can go in with all the knowledge you need to feel comfortable and confident at your exam.
Yes, I see it every day where I see a patient who have in their first pelvic exam, and sometimes they're younger or sometimes they're a little bit older and they've waited many, many years because of the anxiety or even the stress around coming in because of the things that their family or their friends have been through or even some life experiences that they've had, and they don't want anyone to be in that area. And I completely understand, but hopefully after today's episode with us
Yes.
educating them and helping them advocate for themselves, they'll be able to be more prepared going into that exam room.
Absolutely. That's the goal.
Yes.
So, our first topic, we're going to be talking about something really important.
So the first question I think we get a lot, even from our friends and our family, is when should we get our first pelvic exam? And I think that's a big question, or also even who should perform that pelvic exam, because there's a lot of doctors or practitioners who perform pelvic exams that are not always OB-GYNs.
That's true.
Yeah.
I think that, when I have young ladies coming in to see me and they have so much anxiety about this pelvic exam and they're meeting the GYN for the first time, you actually don't have to have a pelvic exam until the age of 21.
Yes.
So if I have ladies coming in and they're 18 and they're 19 and we're educating, we're talking about what's happening at the visit, what are the screening things that need to happen for their age group, they have so much relief in their face
Yes.
when they find out they actually don't have to have a pelvic exam.
I think so. I have a couple parents who get upset with me sometimes when I have their teenager in the room with me, and I'm pointing over here because they're always sitting in a chair in the corner. Because they didn't kind of gave them anxiety about you're going to see an OB-GYN and they're going to do a pelvic exam, and I'm like, no, we're going to get to know each other. We're going to develop that rapport. I'm going to understand why you're coming to me, what your problems are first, and then we'll decide if an exam is needed in the right time. Because 21, like you said, is the time when we definitely start those exams, and we may do it sooner if something is occurring.
That's right. That's right. If there's certainly a problem, we will be doing an exam sooner. But I actually have had some moms bring their daughters in wanting a pelvic exam performed to show them what it is to be a woman. This is not fun and games. To be a woman, to be sexually active, there are some consequences to it. And I've had moms want me to do pelvic exams for that reason.
Yeah. And I'm like, no, this is not a punishment, right?
Right.
This is not a punishment, because we want to start out these healthy relationships with their providers. And I don't want the first time you interact with me and get a pelvic exam is because you feel like you were told you had to have this, especially if things are going well. We can have a conversation of what will be done when it is time for you to have a pelvic exam, what to expect. But I know I've had that a couple of times. And this is not any slight to the parents, because we both are moms.
Yes.
We both have teenage daughters. And so we get it. We want to educate our children, let them know about their anatomy and kind of what to expect in these situations. But there's a certain way about going about those things. And I think sometimes we get that that a little bit forceful sometimes. So I kind of just got to redirect the people in the room.
It just needs to be a nurturing experience, and it needs to be loving and supportive and not be a negative experience.
Yes.
One of the reasons why pelvic exams don't need to happen until you turn 21, because that's when a pap test occurs.
Yes.
The age of 21. Before that, unless you're having issues, we do not have to insert anything into the vagina. We do not have to swab anything unless you come in specifically with a concern that we need to address.
Yeah, I agree. I think that even when the pap smear comes as a topic, we have some patients who think that 18 is the age. And I have to remind people, I understand that that was the age when your mom or your grandmother had to have these procedures done or exams done, but that's changed. 21 is the age, and we don't want to put our young women through an exam that they don't need. It's not indicated. It can lead to procedures that they don't need. And so hopefully the age 21 is something that sticks in your mind. Not to say you may not get it sooner, not to say your doctor who offered it to you sooner was wrong, because there could have been other things that you had going on that led to them saying it's time for a pelvic exam.
Sure. Yeah. And when you're sexually active, you should be tested for sexually transmitted infections every single year. That does not require a pelvic exam.
Yes.
You actually can do that through a urine test.
Yes. I think that one of the things that a lot of people forget about is that we have not only urine tests, we have swabs that occur. That does not mean an exam where we insert something into your body. Some swabs that can be done can be self-swab. You can do them yourself. Your provider can step out of a room and you can perform that.
Hey guys, if you like what you're hearing and you like what you're seeing, hit that subscribe, hit that like so we can bring you more content. Now let's get back to this episode.
I think that helps transition to the point of talking about what happens in a pelvic exam, because we already talked about sometimes swabs, but typically for a pelvic exam, what are you usually kind of talking to your patient about what may occur?
Yeah. So I always look externally first. You don't want to just go and jump into a speculum exam. They already are very intimidated by the whole process. So I like to look externally. I'll touch their leg, ease my way down. I'm looking in the skin folds. I'm pulling the labia back, and I'm talking the whole time.
Yes.
And I have had plenty of times where people are like, thank you for explaining that to me.
Yes.
No one has ever told me exactly what they were looking at, what they were touching, what they were looking for, and what they were seeing.
Yeah. I think that also ties into like a mirror. Sometimes in the room, especially for my patients who have never even looked down there themselves, or they're young or just don't have an idea about their own anatomy, which we have a good amount of patients who don't, I will bring in a mirror, a handheld mirror. Some people even like to do it on their phones because we got things like Snapchat and all these things where they can circle things. And I'm like, pull it out. It's your phone. You can use it. And so we can look at things together. And I'm saying, this is your labia. This is your clitoris, just to point things out to them so that they are aware. So I agree. It always starts with looking externally. That's a big part of the exam, and making sure you understand what we're looking at.
Absolutely.
Yeah.
The other thing is that some people have areas that they have been concerned about, and that might be kind of a time for us to dialogue and for them to point out locations and put spots that they want me to look at, and we can talk through things. You know, there's things that we can identify at the time of external exam, like a sebaceous cyst, an ingrown hair, folliculitis, a boil.
Yeah.
Those kinds of things. Those happen all the time.
Yeah. And it's also a time for us to kind of redirect, because a lot of people say, is something wrong with my vagina, or kind of having a complaint, and it be their thigh, it be another area. And so it's a good way for us to redirect and say, where are you having your problem? I'll give my patients gloves so that they don't feel weird or uncomfortable touching themselves in front of me. I'll give them a pair of gloves at the time too. And I say, point to the area that hurts. Point to the problem where you're having, so that we can kind of dialogue about it and do an education at that time. So I agree. Externally is just as equally as important before we even talk about inserting anything.
Absolutely. Yeah. The next step is an internal exam. So we talked about the external part of the exam. Yes. That's kind of warming everybody up to
the internal.
Yes. To where people are much more anxious about. And so then going into the internal exam, you know, we've got some instruments we want to show you guys to help you feel more educated and knowledgeable about the process.
I know. It's a lot going on here. Don't get intimidated. Sometimes we're going to go through a lot of the instruments and even some swabs, so you can get used to it. Your first time seeing it is not when you go into the exam room, but also you may have, even with the instruments, sometimes they're not used. Sometimes internal exams could be swabs where we don't insert anything else into you besides a Q-tip. Sometimes it can be a digital exam, so a finger exam that is done where we're not inserting anything additional like a speculum. So I think this will be a good transition into looking at what are the instruments that we use.
Yes.